Yeah, it's interesting. I always like to remind people too that when we say osteopath in the rest of the world, they're
It has a
not
different meaning.
right. They're equated with the musculoskeletal capabilities or I'm trying to think of the right word, but essentially chiropractors and osteopaths, they're kind of on the same level of musculoskeletal, what they're able to
Correct.
do. They can't, prescribe any medications. But in this country, it's very unique. We've had
Mhm.
this incorporation of the osteopathic training into the mainstream
Mhm.
physicians in the mid 1900s, and so everything that the MDs are learning are essentially what we're learning too. Unlike the rest of the world, where most of the rest of the world is just learning the
Separated.
muscles. Right, it's
Correct.
separated out. So it that's why even Australia took some time until this century that they decided that DOs are accepted as a physician in their country because it's very confusing. There's
Same
two.
same thing in Canada.
Yeah, yeah.
Yeah,
So,
everywhere else they call themselves pure osteopaths, meaning they
right,
only do hands-on.
right,
But everybody who is American trained is a full-fledged physician.
right.
So we tend to say osteopath for the other countries and osteopathic physician for here,
Right.
which is a mouthful, so I still say osteopath a lot.
Yeah. Yeah, it is. It is very confusing, and the acronyms that we use, they look the same, but they don't mean the same. It depends where they originate from,
Right.
which a lot of people don't. Even some DOs don't realize that. If they haven't looked beyond our own country. But yeah, so I think that the it's really important for people to conceptually understand that osteopathic physicians have, I would say, my best description between MDs and DOs is I do believe that there's a lot of MDs that have a very holistic approach and constantly seek out information.
I
I've met
have some in my practice.
right, and some
Yes.
MDs right, and then MDs that learn some DO skills from
Hmm.
DOs too. But yeah, there's a I think more of a comfort. We have more
Hmm.
comfort putting our hands on patients, and
As a group,
yeah, as a
I
general
agree.
rule.
Although, I mean, one of my teachers was an MD neurologist.
We learn a certain philosophy, we learn how to interpret things from our training, but I think we all know that sometimes there's some things because we never were given the manual at birth. Like we don't
Right.
we don't have always the precise answers, but I do believe that there's times where things help that we may not know why at times. We think we interpret it what cerebrally what makes sense,
Hmm.
but there's probably an element to it that we still have yet to learn too. But
We
that
do not
just
understand all the
touch.
mechanisms.